Hi Meenakshi. Hello, good evening everyone. Jayashree, hi. Can you hear me?
Hi, I can hear you, Archana.
Okay. So we'll just wait for a couple of minutes for everyone to join in.
Sure. Um, Maybe I can just check if we are audible on Facebook as well.
Yeah.
Okay. Audible on Facebook as well.
Okay, am I audible on Facebook? There's a delay on Facebook, so it'll take a little time. Okay, so Jayashree, can you keep the phone near your laptop mic so that people can hear me also on Facebook? Can you keep it closer to your mic?
Um, sure. Can you let me know whether this is better?
Yeah, I'm just testing the audio. Yeah, just a second.
Is this a little better? Um, sure. Can you let me know whether this is better?
Yeah, so can you hear me? Can people hear me on the other side?
Great. Is this a little better? I think we
Okay,
are
so I think we're
audible.
good. So just keep the phone near your laptop microphone so that it's audible. Still in loop. Is it okay? Okay, so hello Meenakshi, hello Dimple, hi Surbi, hi Srijana, thanks for joining in. So we hope that more people will join in as we start this session. So today's session is a very important topic which probably covers, affects all of us. That because of this virus situation, suddenly there are a lot of question marks about your life goals, about your plans, whether it's about your business plans, it's about your relationship plan, somebody has a marriage plan, somebody may even have a simple thing like they wanted to get their house renovated and so now they are stuck, or some of them are actually in the middle of the renovation and then the lockdown happened. So there are a lot of varieties, and like it's affected all of us in different ways. Uh, with different circumstances. Some people are in a different city, they are away from their spouse. Some people are, stuck in some on a business trip abroad and they're not able to come back to India. So there are all kinds of situations. So today, Jayashree, please shed some light on how we can, deal with these uncertainties, because I mean to say the only thing I do is I worry about my own problems and then I say, okay, I'll not worry today, I'll worry tomorrow. But I don't know if that is the right approach. So, so how, you probably have people coming in and asking you that how does uncertainty affect, how do they cope with it and how does it affect us? So uh, please go ahead and, would like to hear your thoughts.
Yes, definitely, Archana. I mean, this is something that, a couple of months ago, at the beginning of the year, it's not something that we would have ever imagined would have happened. I mean, we all had our plans. As you were mentioning, some people had marriage plans, maybe some people had, business plans. Possibly this is now approaching the summer vacation period. People may have wanted to go visit relatives, plan a holiday. And a lot of these things have definitely been impacted. And that's not to say, other aspects of our lives have also been impacted. So there's, the whole COVID-19 pandemic has definitely thrown all our lives into a lot of uncertainty. And, some people actually, a few people do thrive on, uncertainty. They, the kind of personalities who like to take risks, the kind of people who, enjoy, get that high from, an unpredictability of, a day-to-day kind of existence. But by and large, most of us prefer to be in an environment where we have certain control over our daily lives, our activities. We actually thrive on some or the other form of structure or routine. And most of us right now are feeling quite overwhelmed because we don't know what's going to happen. It's very hard for us to predict a lot of things, and that's leading to a lot of anxiety amongst people. So that's what we are seeing, a lot of people coming in with just, people just saying they're feeling incredibly anxious and they don't know how to deal with this uncertainty.
Yeah. So what are the symptoms of anxiety? If you can just, how does one identify that it's a normal worry or it's something which is now going to affect my mental health? If you can share some things to look out for.
So that's a really important question, Archana. It's, what are the signs and symptoms of anxiety, and how do we differentiate this from just normal worry? So, the most obvious sign, which I think, all of us experience at some point or the other, we all become anxious at different points, but, is this sense of, feeling very tensed, constantly on edge. So that's one sign. We may have repetitive thoughts coming into our mind that, it's just hard for us to concentrate on our activities, on the things that we need to do, our work. It could be our, the jobs that we're doing. We may find ourselves having to put in that extra effort to really get a job done. We may find ourselves struggling to do things that we were managing very well up till now. You may be, managing your household activities fairly efficiently up till now, but right now you're just finding it difficult to, plan the lunch, dinner menus. It's just becoming harder and harder to concentrate on things. There may be an overwhelming sense of doom, sense that things may not be getting better. People may also experience mood fluctuations. So, when you're anxious, it doesn't mean that you only experience worry. You may actually feel very irritable. You may find that, small things set you off. You may find that, things that you used to enjoy before aren't that much fun. You may find yourself just getting irritable with people in the house. So that's another sign of anxiety, which is people often miss. And then there are people who don't have any of these kind of cognitive, so like the thoughts, the worry, these repeated thoughts and concerns, or these behavioral symptoms where you become irritable and stuff. But you may actually have more physical symptoms. So if you find yourself perhaps losing sleep, you're not able to sleep, you're not able to, through the night like you were previously. You may find, you start thinking about something and then you experience, a shortness of breath, your heartbeat increases. Maybe you're watching the news about the lockdown and trying to see how this is going to impact your work. And whilst you're watching the news, you suddenly realize that your heart's racing and you're sweating and you're just feeling really out of control and panicky. So these are signs of anxiety. And by and large, most of us experience some of these symptoms at some or the other point in our lives. So for example, we all may have experienced some butterflies in our stomach, which is the physical symptoms associated with anxiety when we're giving an exam, or we're going for an interview, or there's a meeting that we have to go for. And usually that little bit of anxiety is actually good for us because it actually pushes us to perform. But if this continues, what happens is we tend to focus on these physical symptoms, and we think that our brains basically tell us that because we're feeling these physical symptoms, there has to be something wrong with us. And that's when this turns into this becomes more problematic, and it becomes a vicious cycle. And that's the time point at which, if you can't break out of that cycle, it's probably best that you meet a professional, discuss it with them, because it's important that you don't stay in this state of anxiety for too long. It can cause symptoms of burnout. It can make you feel much worse. So it'll have an impact on other aspects of your life. So these are the kind of cognitive or thought related symptoms to watch out for, some physical symptoms to watch out for, and some behavioral signs to watch out for. So if you have family members telling you you're becoming what has happened to you, you've changed, why are you becoming, why is your fuse so short these days? Maybe it's a sign of underlying anxiety.
So now, Jayashree, this is the fourth extension of the lockdown, and in many places things are opening up. What are the kind of challenges people are facing at the moment, in terms of now suddenly life seems to be getting back to normal, or seems to be normal, we seem to be getting there.
Yes, I mean, thankfully, life does seem to be inching back towards normalcy. We've seen a lot of things opening up over the past couple of days, and this is really great. But however, I think what begins to impact people is the fact that there isn't still much clarity on when this is all going to end and when things are going to get back to 100% normalcy. And particularly, I think for people in the workforce, this has really impacted people very heavily. So we've had this prolonged period of where people who are in jobs where they're able to do work from home have been managing. But there are a lot of industries and sectors where that's not been possible, and those have been hit very badly. So there's a lot of concerns, a lot of uncertainty still around how those things are going to pick up. Then there's a lot of concerns and anxieties that people reach out to us for, with relation to health. So particularly elderly people are concerned about, even if things open up, will I still be at risk for the infection? So what steps do I need to take? Is it safe for me to go out even if things open up? And and similarly with children, I think these are the two groups where we've seen a lot of people having concerns. But it's important that we since we don't know still, it's important to follow the basic, safety precautions that we've been following up till now. And there are several guidelines on how to maintain, basic hygiene, maintain the social distancing where it's possible, because these are going to minimize the risks of, contracting the infection. And you can still, try to re-engage yourself with activities that you used to do previously, keeping these safety precautions in mind.
Okay, yeah. So, we are opening up the lockdown, and more cases are coming up. So today we had a case in our complex. So suddenly, people are wondering whether they should be going out for those morning walks, and especially senior citizens, who are uh, who are very keen to get the outdoor, in the morning and evening. It's been a part of their routine. So I know that they're really missing that 30-minute 1 hour walk which they used to enjoy earlier. So what are the most important things to keep in mind, while dealing with all these uncertainties? Uh, what would be the things to watch out for?
Yes, it's, um, uh, we are actually seeing that there are cases that are cropping up, and obviously that's just adding to the uncertainty, even though things are opening up. But when it comes to what are the things that we need to keep in mind whilst dealing with all these uncertainties, I think it's important to remember 3 A's. The first is, to really try and see if you can accept what you can't control. So we can't control a lot of things. So, for example, what you just mentioned, that there's unfortunately that there has been a case. People were getting back to normalcy, but then again they have to possibly follow certain restrictions again, for the larger safety requirements. So yes, those things, there may be ups and downs there, and we may not have control over these factors. There's no point worrying over it. So that's the second day. The first is accept what you can't control, and the second is really avoid worrying. So a lot of times we think that if we meticulously think through the pros, the cons, and worry over, if I do this, what will happen, or if I do that, what will happen. And we try to plan, for every possible eventuality. It actually can be a little counterproductive, because you end up worrying a lot, and you end up, feeling incredibly overwhelmed by this entire process. So, so avoid using worry as a way to solve problems that you're facing. A lot of times people start, thinking in very distorted ways, and these are called thinking errors. And that's one thing that we need to watch out for. And the third thing, the third A, is really, to aim for the future. So, it's important to remember to remain positive. This is something that's temporary. It will end. Things will become, better. And even if this has impacted our lives in, unpredictable, unimaginable ways, we need to see how we can plan for the future. So what is it that you can do right now, which is going to help you they just don't know what's happening, or a lot of people may be worried that they are, about losing their jobs. So rather than worrying about the pros, the cons, or making like plans on that angle, is there something that you can do to perhaps develop some skills for yourself, so that you're using that time more productively? So 3 A's: accept what you can't control, avoid using worry to deal with these problems, and aim for the future, and so that you can use this time to plan?
So I'm really curious to know about this term you used, Jayashree, thinking errors. So can you shed some more light on this? And for the benefit of the Facebook viewers, can you just check on the chat window there that they can hear me or repeat the question, because I think there are somebody is having audio issues. So, but what are these thinking errors you have been talking about?
Okay, so let me just check the audio. Is this a little clearer for our Facebook viewers? If someone could just give me a thumbs up, that would be great.
And while
So
we are discussing this, please request people to type in their questions, and here as well on Insta, if people have any questions regarding anything which they would like to, ask, please do type in your comments and we will take it up.
yes, so please, if you've joined us through Facebook, do type in your questions into the chat window, and we'll do our best to address those. So yeah, Archana, you asked me about thinking errors. So these are really maladaptive ways, or faulty ways in which we think, and these are patterns of thinking that we sometimes engage in unknowingly, and this is really a pattern which is it turns into a bit of a vicious cycle where we're and these thoughts become quite self-defeating in nature. So, so for example, if to give you one example, if your friend, somebody has lost their job, maybe you say that this thought comes into your mind that if this lockdown doesn't open up and things don't turn back to normal right now, I'm probably going to lose my job too. Because so that's an example of catastrophizing, where literally what the way in which you're thinking because of this recent event that has happened with your friend, you begin to think that this is possibly a reality for me as well. And we've seen a lot of people, because of the ambiguity and this uncertainty right now in the COVID situation, a lot of people, when they're anxious and they're worrying, they tend to think in this manner. So when something is not, because they're afraid, there's a lot of fear about the future, and there's a lot of things that are very important to us stand to get impacted. And what happens is when we start thinking in this way, our brain kind of looks at, whatever has happened, and we tend to be very irrational in the way that we're evaluating this information that's out there. So yes, maybe it is very unfortunate that your friend has, lost their job. But does that necessarily mean that you will also lose it? Is that's not 100% sure. But if you begin to keep focusing on this, you will pull yourself down, you'll begin to feel more negative about it. And that's where this maladaptive way of thinking impacts your mental well-being. So this is just one example of a different kind of what, some of the cognitive errors and the maladaptive patterns that we follow when we fall into, really, when we begin to feel anxious.
Yeah, so Jayashree, this is this is really good coming from a clinical psychologist, that don't overthink, don't be anxious, but very hard to practice for a common person like me, for example. So how do you what are the techniques to stay calm during this time? And are there any um, techniques or relaxation exercises or things like that which you would recommend, or any other modifications in our lifestyle which would help us get through this?
So I think it's not just it's not easy for anyone really right now. I think all of us have been impacted by this in some way or the other, and it isn't easy to stop worrying. But the first thing that we really need to do is become aware of when that worrying is beginning to impact our health. So if we're having any of these symptoms of anxiety that I described earlier, if you find that if you find you're waking up in the morning, for example, with this sense of dread, or you're finding that you're not able to concentrate, to get yourself that motivation to actually start following your day-to-day activities, that's something you need to pause, stop, acknowledge the fact that this is happening to you. And it's happening to a lot of us right now. And at some point or the other, I think we've all experienced it. I've also experienced it. We're all experiencing these kind of, anxieties because of this entire situation. So the first thing to do is really, to recognize when these kind of, when you're falling into these difficult situations where you're finding it hard to stop worrying, where you're finding it hard to really continue with the kind of things that that you were previously managing fairly well. So that's the first thing to do, is really start to recognize that. The second thing to do, if you're really worrying constantly, is to actually start to rationalize with yourself. I know a lot of people, for example, we've with the lockdown opening up, there's a lot of debate over whether household help should be allowed back into the to
Right.
to support us, because that's one of the challenges that a lot of women are facing, a lot of families are facing this right now. And people are really worrying about, how can, should I, shouldn't I, what are the risks and all. So this is something that is a cause of worry. So yes, be rational about it. Is there a way, do you think that it will be putting yourself at risk? Are there any ways that you can minimize that? So be rational, think that through in a rational manner, rather than catastrophizing and saying, if I allow my health to come back and support me, I'm definitely going to get COVID. So that's not the way you want to think this through. You want to be a little more calm and think it through a little more rationally. See whether there are certain things that you could possibly do to make it, put yourself at less risk, and also to put the other person at less risk. The other really important thing which you were also mentioning, Archana, is to relax. So it's really, really important to to incorporate some time for yourself. Use some method that works for you to help you relax. So I know for a lot of people, they're doing meditation, fixed time in the day when people get together with the family works to help them relax. Definitely avoid looking at COVID-related updates throughout the day, predicting where this is going to go. Because again, it's important to just accept that this is not something we really have that kind of control over. So we just need to let that go and move on with whatever we can.
Okay, that's very interesting. So there are a lot of people who are joining in on Insta Live. So please do type in your questions if you have any. And I have a question here, Jayashree. Should we plan the future? So some of us have plans coming up in the later half of the year. Whether it's business or personal. So should we plan conservatively or optimistically at this point of time? That's a question which many of my friends are asking.
I think that's a really tough question. I wish I had the perfect answer, but I think it's good to be optimistic at the moment, and plan, probably plan a little conservatively. So be rational in your planning. Think through. You may have had plans to do A, but because of the situation, it's you may have to modify those plans a bit. So you can't think that you may not be able to do exactly everything that you had in mind at, when you were planning 3-4 months ago. So you may have to modify your plan a bit, but definitely I think it's very important to remain optimistic. Because if you don't remain optimistic, that's really going to pull you down. And sometimes, yes, I mean, actually the, uncertainty is, it's probably the only certain thing in our lives. We really actually don't have control over very much in our lives anyways. But I think that's, this entire COVID scenario has just brought that to the forefront. But we're always juggling with uncertainty in some or the other way, and we're always adapting our plans to deal with that. And I think we need to remember that this is, when we're feeling really low, it's important to remember that this is, there are ways that we've dealt with this in the past. And that sometimes, a modification in our plans may have actually worked out for the best. So yes, I think it's important to be flexible, when we're doing this, doing any sort of future planning right now.
Well, that's a wonderful insight, Jayashree. So what I got from you is that plan conservatively, but be optimistic, and chin up and hang in there, right? That's what you're saying.
Absolutely. Absolutely. I think it's always really important to remind ourselves that this is a very, it is temporary, things will get better. We have to remain positive. We can't get pulled down by this. We've all experienced ups and downs in our lives before, and we've dealt with them. And this is yet another one of them. It's impacted everyone in some way or the other, at this time. So, and yes, things will definitely get better.
Okay, wonderful, wonderful. So, any other questions anybody has? Otherwise, Jayashree, any parting words? Anything you can talk about deep breathing, and how deep breathing exercises help?
So that's a really, really important technique, deep breathing exercises. Deep breathing is really useful. It's a very simple technique to relax ourselves with. It's a very simple technique, or the simplest probably, is just focus on your breath. Focus on your breath as you're breathing in, and then focus on your breath as you're breathing out. So, just breathe in through your nose, focusing on your breath slowly, and then breathe out through your mouth, again, whilst focusing in your breath. And, any thoughts that come into your mind at that time, they're there. Thoughts will come into our minds when we're trying to relax, but just let them be. And studies have shown that, even up to 5 minutes of deep breathing in a day can actually help us relax. It helps to calm us down. It helps us to reduce the stress that we're feeling. So I mentioned that it's important to first identify and become aware of the kind of stress or worry, the kind of anxiety or low moods that you may be going through. And when you do that, even a simple breathing technique like this, even for 5 minutes, it can actually work to help improve your mood. Physiologically, it also, leads to greater blood flow to the brain, get more oxygen into the brain. And, all of these things actually help us to, alleviate our stress at that moment. So definitely, if, it's one of the first go-tos for that time when you're, if you find your thoughts whizzing through your head and you just find you are really, feeling very tensed and on edge, just stop to take a deep breath and try and focus on your breathing. It's very, very effective.
Okay, Dr. Jayashree, thank you so much. I want to say thank you so much for your time today and sharing the tips and the things about overthinking. I think very important, as well as how to stay sane and keep your head above water, relax, recognize, relax, and remain calm. So Really useful insights, very valuable. A lot of us don't talk about these things because we are scared that we are going to be stigmatized, or we will be, somebody is going to say, oh, this person is not strong mentally. But I think at this point of time, it is our endeavor through these programs to reach out with all these topics. And, even if people are today, probably some of them are live, some of them are not live, but then they could at least, watch it later, and, and hopefully have some takeaways from these. So, very important points and very useful insights, Dr. Jayashree. Thank you so much. It was wonderful having you on Insta Live, and we hope that our viewers are enjoying these sessions. Please do tune in and write to us if you want us to take up any topics, and we look forward to seeing you again for our next session. Have a good evening, everyone. Take care, and see you soon. Thanks.
Thanks a lot.
Thank you. Thank you, everyone. Thanks, Tarka. Thanks, Dimple. Thanks, everybody, for joining in. Thanks, Pritika. Thanks, Poonam. Thank you. Please see you again soon. Thank you.